When the emergency code alarm rang as surgery was about to end, Nurse Ashley Thompson was preparing to leave the operating room because she was going to the wedding of her Army friend who saved her life that evening. When two critically injured patients were brought in and the doctor was still in surgery, Ashley ran to the emergency department. "I'll assess the injured," she said decisively to the other nurses. But when she saw the injured, she froze because they were Marcus, her soldier friend whose wedding she was going to, and his fiancée Sarah. And in the next 30 minutes, everyone at the hospital would learn who Ashley Thompson really was. Because some people wear nursing uniforms but are actually people who have been saved in battlefields. Welcome to Hidden Legends. Before diving into this incredible story, tell us in the comments what city you're watching from today and hit that subscribe button. Don't forget to hit the like button to help us reach more viewers. Ashley Thompson was the perfect surgical nurse at St. Vincent Hospital. At 29 years old, she had been working at the same hospital for 4 years, never receiving complaints, quietly doing her job. Patients loved her because she was compassionate and patient. Doctors trusted her because she stayed calm in every situation. "Ashley is our most reliable surgical nurse," said Chief Physician Dr. Williams. "She never panics, stays controlled even in the most critical surgeries." But Ashley's ability to stay controlled came from very different places than normal nursing education. Ashley's shift routine was exactly the same every minute. She started her shift at 7 a.m., prepared surgeries, assisted doctors, and supported post-operative care. But this support was different from an ordinary nurse. She assessed every surgical procedure with military precision, detecting critical complications in advance. Her colleagues noticed the depth of Ashley's medical knowledge. "Ashley, how do you know surgical procedures so well?" they would ask. "Experience," Ashley would say briefly. She never went into details, never talked about her past. Ashley's equipment was also different. Normal nurses carried basic surgical supplies, but Ashley's bag contained combat medicine-level medical materials. Advanced trauma kits, battlefield surgical supplies, equipment designed for emergency surgery. Ashley Thompson's real story began 10 years ago. She had joined the Army at 19. But why? Ashley's mother was a nurse, and Ashley had been drawn to the medical field since childhood, taking her mother as an example. Her mother's compassionate patient care and medical dedication had inspired Ashley toward nursing. That day, she made a promise to herself. "I will provide the best medical care like my mother. I will serve people, walk in her footsteps." When she joined the Army, she had gravitated towards 68W Combat Medic. But after basic training, she was selected for an advanced program. Special Operations Combat Medic SOCM training, the most prestigious program. Army SOCM training was 24 weeks of advanced medical care training in high-intensity combat zones. Ashley was one of the most successful female graduates of this program. Ashley wasn't just learning combat medicine, battlefield surgery, medical procedures under hostile fire, multi-casualty mass casualty events, medical leadership under high stress. Most importantly, tactical medical coordination and team management. Ashley's SOCM training wasn't just basic combat medicine. Modern Army Special Operations medics received advanced trauma surgery, prolonged field care, and austere environment medical operations training. "A SOCM's job isn't just bandaging," said her instructor, Master Sergeant Rodriguez. "You're the person making medical decisions in combat zones. Even with limited resources, even without backup, you will save the wounded warrior." Ashley had embraced this philosophy. Producing medical solutions with limited resources, medical leadership in critical moments, calm medical judgment under combat stress. The hardest part of her training was prolonged field care, medical care for extended periods, patient stabilization with minimal resupply, advanced medical maintenance during evacuation delays. Ashley had developed exceptional abilities in this area. Her first deployment was Afghanistan, Special Operations Task Force Medical Support. Ashley's most challenging case was multiple casualties with complex IED blast injuries. She had kept 5 critical patients stable for 8 hours with limited medical resources during evacuation delays. Her second deployment was Iraq. urban combat medical support, high-threat environment operations. During this period, Ashley had performed the most complex medical procedures: field surgery during mortar attacks, casualty care under sniper threats. Her third deployment was classified counter-terrorism operations, Tier 1 units medical support, sensitive site exploitations medical backup. Over 8 years, Ashley had handled 180 combat medical cases, never losing a single one under extreme conditions. But the incident that really changed her was the operation where she met Marcus in Afghanistan. In a roadside bomb attack, Ashley had been critically wounded, and Marcus had stabilized her for 12 hours, keeping her alive until medevac arrived. During that operation, Ashley had experienced his life-saving skills. That night at the forward operating base, Ashley had told him, "You saved my life. I owe you everything." Marcus had replied, "We're soldiers, we save each other." After receiving an honorable discharge in 2019, Ashley had made a civilian transition. She used VA counseling, career transition programs, and civilian medical certification. But Ashley's goal was clear. Her combat zone medical experience had directed her to serve people in civilian health care. Ashley followed her mother's nursing example, developed skills through military service, and continued her healing mission in civilian life. Hospital nursing had been a perfect choice. It reminded her why she had chosen the medical field. But more importantly, it allowed her to be in a position where she could be ready for medical emergencies and surgical crises in civilian health care. When St. Vincent Hospital hired her, Ashley was overqualified. Nursing degree, 8 years of military medical experience, SOCM certification. But the hiring committee hadn't asked detailed questions. "I've always loved surgical nursing," Ashley had said, and this time she was genuinely sincere. Ashley's hospital duties seemed simple: surgical prep, doctor assistance, post-operative care. But Ashley was doing much more. She evaluated every surgical case from a SOCM perspective. She detected potential complications early. She identified critical situations in advance. "Ashley, how do you anticipate surgical procedures so well?" asked her colleague Lisa. "I learned the basic principles from my mother," Ashley would say. "She was also a nurse. She taught me the importance of medical care." This experience came from 8 years of combat medicine training. SOCMs make rapid medical assessments, make critical decisions, coordinate teams in high-pressure situations. Ashley also knew the hospital's emergency systems very well: surgical equipment locations, emergency protocols, backup procedures. She had a complete emergency map of the hospital in her mind. On Saturday morning, May 20th, Ashley started her normal surgical shift. She had routine gallbladder surgery scheduled with Dr. Peterson. They would finish in the afternoon. Ashley was excited because she had a very special event that evening: Marcus's wedding. The soldier friend who had saved her life in Afghanistan was finally marrying his fiancée, Sarah. "After surgery finishes, I'll go directly to the wedding," she told her colleague Lisa. "Marcus really wants me to be there. The gallbladder surgery with Dr. Peterson was proceeding smoothly. While Ashley was assisting, she was thinking about Marcus, how proud she was of his successful transition to civilian life. At 3:30 p.m., surgery was almost complete. Final sutures remaining, patient stable, ready for transfer to recovery. Suddenly, the hospital overhead speakers activated. "Code Blue, Emergency Department, Code Blue, Emergency Department, multiple trauma, ETA 2 minutes. Ashley immediately became alert. Multiple trauma calls triggered her combat medical instincts. As Dr. Peterson completed the final sutures, Ashley felt conflicted. She wanted to prepare for the wedding, but the multiple trauma call had activated her SOCM training. "Dr. Peterson, surgery is almost done. Should I check the emergency department?" "Ashley, your shift is over. Go to your wedding. ED staff will handle it." But Ashley was already moving toward the emergency department. Her 8 years of combat medicine experience had taught her that her expertise might be needed in multiple casualty situations. When she arrived at the emergency department, she saw chaos. 2 ambulances had arrived. Paramedics were transferring critical patients. "What's the situation?" she asked charge nurse Jennifer. Car accident, high-speed collision, 2 critical patients, both unconscious, multiple trauma. Dr. Harrison is in surgery, doctor. Kim is on an emergency call. Ashley looked at the patients and her heart stopped. The first patient was Marcus. The second patient was his fiancée, Sarah. Ashley froze. Marcus, the soldier who had saved her life in Afghanistan, was now on a gurney unconscious, covered in blood, showing signs of severe head trauma. Sarah, the beautiful bride-to-be, who was supposed to be in a wedding dress this evening, was now in critical condition, with chest trauma and breathing difficulties. "Ashley, are you okay?" asked Jennifer. Ashley took a deep breath. Combat medic training initiated automatic response. "I know these patients," she said with a calm but determined voice. "They're friends. I'm taking primary care." "Ashley, you're a surgical nurse, not ED." "Jennifer, I'm qualified. Let me handle this." Ashley was already approaching Marcus. SOCM training kicked in, rapid trauma assessment, priority evaluation, critical intervention planning. Ashley examined Marcus. Severe head trauma, possible traumatic brain injury, unstable vital signs, critical condition requiring immediate intervention. She moved to Sarah. Chest trauma, probable pneumothorax, respiratory distress, also critical, requiring urgent care. Her combat medical experience enabled rapid triage decisions. Both patients were critical, but requiring different specialties. "Jennifer, I need trauma team stat. Marcus needs neurosurgery consult. Sarah needs thoracic surgery. Both need immediate stabilization." "Ashley, how do you know this? This level of assessment?" "I'll explain later. Right now, I need trauma cart, intubation equipment, chest tube insertion kit." Ashley was already working on Marcus's airway management. Advanced trauma life support techniques, learned in combat medicine, applied in civilian hospital. Ashley was providing advanced medical care to Marcus, intubation, cranial pressure monitoring, neurological assessment. This level of expertise exceeded normal nursing scope. "Ashley, where did you learn these procedures?" asked arriving trauma resident Dr. Young. "Military experience," Ashley said while checking Marcus's pupils. "I'm former Army SOCM. Dr. Young was surprised. "Special Operations Combat Medic? That's advanced training." "Yes, right now Marcus needs cranial decompression, possible emergency craniotomy. Sarah needs chest tube insertion, probable pneumothorax." Ashley moved to Sarah, performing chest examination. Combat medical skills were automatically applying. Tension, pneumothorax diagnosis, needle decompression consideration, surgical airway assessment. Ashley began coordinating the emergency team using her combat medical leadership experience. Dr. Young, focus on Marcus, cranial monitoring. Nurse Jennifer, Sarah's chest tube preparation. Respiratory therapy, both patients ready for mechanical ventilation. The team was responding to Ashley's command presence. Military medical leadership training was manifesting in civilian healthcare. "Ashley, this level of coordination," said Jennifer, amazed. "Combat medicine teaches multi-casualty management," Ashley said while assisting Sarah's breathing. "Every case matters. No one gets left behind." Her SOCM training principle: never abandon wounded, maximum effort for every patient, resource optimization, team leadership. Both patients required critical care simultaneously. Ashley split attention between Marcus and Sarah using her combat triage experience. Marcus's cranial pressure was increasing, needing immediate surgical intervention. Sarah's respiratory status was declining, chest tube insertion urgent. "Dr. Young, prepare Marcus for OR. I'll handle Sarah's chest tube." "Ashley, chest tube insertion is a physician procedure." "Doctor, I'm SOCM trained. I've done this under fire with minimal equipment. I can handle civilian OR." Ashley was already preparing chest tube equipment, 8 years of combat experience, dozens of similar procedures in life or death situations. Ashley performed chest tube insertion on Sarah, military precision, combat medical training, optimal results with civilian equipment. Sarah's breathing immediately improved, vital signs stabilized, procedure successful. At the same time, Marcus was being transferred to OR, ready thanks to Ashley's assessment and preparation. "Ashley, Both patients stable thanks to your intervention, said Doctor. Young, impressed. This is what we trained for, Ashley said humbly. Save lives, whatever it takes. But at that moment, Ashley realized she wasn't just a nurse anymore. Her combat medic identity had emerged in front of her colleagues. Dr. Williams, hospital chief, arrived at the emergency department. He reviewed situation reports. Ashley, I understand you provided extraordinary care today. Your background? Ashley paused for a long time. It was time to break 4 years of secrecy. Sir, I served 8 years U.S. Army Special Operations Combat Medic, 3 deployments, advanced trauma training, multi-casualty medical operations. Dr. Williams was stunned. SOCM, that's elite medical training. Yes, sir. Today's patients, Marcus, he saved my life in Afghanistan. Sarah, his fiancée, they're getting married today. He saved your life before? Combat zone, roadside bomb. He kept me alive 12 hours until medevac. Dr. Williams's understanding dawned. And today, you saved them both. Dr. Williams organized a private meeting with Ashley. Ashley, today's performance was exceptional, but your military background, why not mention during hiring? Sir, I wanted a civilian fresh start, nursing, helping people peacefully. Ashley, your skills today, trauma leadership, advanced procedures, multi-casualty coordination, this far exceeds normal nursing scope. Military medical training is comprehensive, sir. Combat medicine teaches adaptation, life-saving solutions in any situation. Dr. Williams was impressed. Ashley, would you consider trauma department leadership position? Emergency medicine coordinator? Ashley hesitated. Sir, I prefer patient care, but training other staff, yes, I could help. 2 days later, Marcus regained consciousness. Surgery was successful, full recovery expected. Sarah was breathing independently, chest tube removed, vital signs normal. Ashley visited Marcus in the ICU. Marcus, how are you feeling? Ashley, they told me you saved us, just like you always do. Marcus, I just did what needed to be done. Ashley, you were supposed to be at our wedding. Instead, you saved our lives, just like you always do. Tears in Ashley's eyes. Marcus, you saved my life in Afghanistan. Now I could save yours. We're even, Sarah, weak but smiling. Ashley, Marcus told me how he saved you in combat. Now you saved both of us. You're truly family. 3 weeks later, Marcus and Sarah had fully recovered. They were planning a new wedding date. Ashley, said Marcus, would you be my best woman? Not best man, best woman. You saved my life, and I saved yours. We're connected forever. Ashley was emotional. Marcus, I'd be honored. Sarah, Ashley, you'll be part of our family forever. Our children will know their Aunt Ashley, who we saved each other's lives with their Uncle Marcus. The wedding invitation had a special line. Thanks to Ashley Thompson and Marcus Johnson, we're all alive to celebrate love. Ashley remained humble. I'm just glad you're both healthy. Ashley's story spread throughout the hospital. Colleagues showed new respect. Ashley, said Lisa, working with you, I feel safer knowing your background. Other nurses requested training. Ashley, teach us advanced skills. Ashley started a limited training program. Basic trauma assessment, emergency coordination, calm under pressure. Most importantly, every patient matters. Dr. Williams offered a new position. Ashley, trauma nursing coordinator. Train staff, develop protocols, emergency leadership. Ashley accepted. Sir, I can serve patients better by preparing others. 6 months later, Ashley was still working at St. Vincent Hospital, trauma coordinator but still hands-on patient care. Marcus and Sarah's wedding had been beautiful. Ashley had stood as best woman, proud but humble. Ashley's training program expanded. Other hospitals requested her expertise. Military medical skills for civilian health care. Police departments started collaboration. Medical tactical cooperation. Emergency response training. Ashley's greatest achievement, Marcus and Sarah healthy, happy, alive. friendship transcended military service, continued in civilian life. Dr. Williams. Ashley, ever regret leaving military medical service? Ashley, indicating patience. Sir, I served soldiers 8 years overseas. Now I serve everyone here at home. Same mission? Ashley looked at Marcus and Sarah's wedding photo in her office. Yes, save lives, protect people, never leave anyone behind. Ashley's story isn't just medical heroism. It's about military skills applied in civilian life, the power of friendship, continuation of service commitment. Because sometimes the greatest medics wear nursing scrubs, work hospital floors, save lives with both military precision and civilian compassion. Marcus is always grateful. Real heroes save each other when needed. That's what makes us family. The courage Ashley showed that day at St. Vincent didn't just come from SOCM training. It came from the gratitude that Marcus had saved her life, her mother's nursing example, and her commitment to service to others. I'm no longer a soldier, Ashley would say. I'm a healer, protector, friend. But that day she had shown that sometimes you have to use military skills to heal, apply combat training to protect. Most importantly, friendship and service never end. They just change form. So I ask you, do you know modest service members around you, healthcare workers with military backgrounds who remain quiet? Are you curious about their hidden stories? Share in the comments. Because here at Hidden Legends, we believe real heroes can be found in the most caring professions. If this story moved you, share it, subscribe, and help these important stories continue. See you in the next legend. And remember, the nurse helping you in your next medical emergency might have life-saving military skills you never knew about. Real healers change uniforms, but never change their mission. Save lives, protect people, never leave anyone behind.